Welcome to BCN's new series, What's Happening Now, a collection of informational and hopefully entertaining programs where we substantively speak to interesting and important people. And today, we're fortunate to have Beaufort County Health Director Jim Madson, who's agreed to come and speak with us about COVID. Here we live in the age of COVID. Everything we do, every event that we experience in life now is somewhat monitored by COVID. There's no way around it. I wish we could go through life and forget about it, but we can't. And that's why we have Jim to update us and let us know it's all going to be all right.
It's good to be with you, Stan.
No, thank you, Jim. God bless you. Jim is our health director, as I just mentioned. He comes to our meetings once a month now, and he gives us an update. And you can see those updates on Beaufort County Now. But we've got him close and personal. We're going to ask some specific questions, and Jim wants to impart some information to us that we might not ask or we might not normally get otherwise. We'll be more than fortunate for it. One of the things we're doing here at our What's Happening Now show is we're wearing masks right up until the point we start talking. Jim's got his, I got mine. We're doing it to celebrate Jim because Jim is going to push the rightful thing to do, which is to wear a mask when you're out, social distance every time. Wear a mask when possible, but always social distancing. Would you speak to that first?
Well, yes, that's one of the best ways of preventing the spread from person to person is by practicing social distance, because the droplets that come out when you breathe and talk and cough and sneeze, it's hard for it to travel further than 6 feet. So if you maintain that distance, it's a lot harder for droplets to get there. And of course, that's the point of having a mask on as well, is to capture people breathing out droplets that may have the virus in it.
And droplets, can they go beyond 6 feet?
Well, they can, but it's very hard for it to get that far out, yes.
If any of you have seen any of our other episodes, our productions of those episodes, you'll notice that we're a little closer. We've decided with the increase of cases here in Beaufort County to push it 1 foot further. So Jim's a good 7 feet away from me right now. And we're not shaking hands. We're not even bumping elbows. We're pretty much keeping our distance. And we're trying to have an intellectual closeness right now. That's about as good as we're going to get right now in this age of COVID. One of the things that people were told in the very beginning that masks were not important, and not to go for masks, not to buy them up off the shelves, allow other people that are in the medical profession to use it as PPE. But now we, citizens of America, need to wear masks as much as possible. Wouldn't you say?
That's correct. I think early on, there was a couple of worries about not having enough masks for the healthcare providers who are going to be working with the patients that actually have the virus. So it was in part to protect them. And also, I think it was early on because the mask is not 100% effective. So you'll see out there examples where they show that the mask, allows 50% or 90% or 10%, depending on what you're looking at, of droplets to still pass by. But the reverse of that is that it's stopping a lot of the droplets from getting past as well. So the worry was if you recommended masks, people would think it's 100% protection. But, it's the fact that it's not 100% protection makes it harder for you to recommend it. But at this point, even a 10 or 20, 50% protection is better than no protection at all.
The N95 mask.
Which is different, yes.
That's the big mama. That's the
right.
The one you really want to get if you get your hands on it.
That would be to protect the wearer. See, we're wearing the mask for the most part in order to protect everybody around us for when we cough. But when you need protection, like the N95 would be the best option because it's been shown to block droplets from getting into the person wearing it.
You mentioned coughing.
Yes.
Coughing is a projection of droplets,
Correct.
Probably to a greater extent than talking. Can you speak to the distance that a good hard cough will project droplets as opposed to just us speaking right now?
Well,
neither one of us coughing, neither one of us sick.
Well, the 6 feet is more for the coughing part of it. It's hard for somebody to project droplets 6 feet when they cough.
Yes.
So the 6 feet rule is really more looking at a cough.
Okay.
Where casual conversation, you're probably closer is okay. But again, when you try to make a rule that people to follow, you want to keep it simple. So you don't want to say it's okay at 2 feet for this and 6 feet for that. So that's why the 6 feet is really the recommendation.
Yeah. Interesting point. We have provided some meals for one of my neighbors who works at the hospital. He's a pulmonologist. And he came over to bring some of the plates back last night. And I was talking to him. I will tell you, he would not let me get within 10 feet of him.
Right.
He was extra social distancing, and I think it's because he's seen so much. Pulmonology being the end result of the devastation of the worst of it.
Right.
And since we're talking about the worst of it, are there certain different virulent strains of COVID, some worse than others?
Well, there has been some studies that show up to 3 strains are speculated on. But, a virologist, what they call strains, kind of varies, by how far apart they are genetically. And so it's not 100% sure that there are 3 different strains of COVID, So I haven't seen anything that says that one strain is worse than another strain.
Yeah, understandable. It's just certain people that get sick, really sick, and then they perish from this temporal plane. Is it underlying conditions that they might have?
Well, yeah, individuals' responses to the virus or to any kind of viral infection is based a lot on what the person has, how much they've been exposed. Because I could get exposed to a little droplet or a few of the viruses, maybe enough to kick in and get a small response that may feel like an allergy, a reaction or something like that. And then another time I might receive a big dose of the virus and now it overwhelms my system. And that's when I would more likely have a systemic response, which is the cough and the fever and those kind of things. So in part, it's how much I get exposed to as far as the number of droplets of the viruses that I get exposed to, as well as my immune system's ability to stop it when it does get into my body. And then it also matters where it goes, because if it gets into the nasal area, sometimes you can have a response in the nose and it doesn't even get to your system as a whole.
Oh.
So you may test positive. You may fight it off in the nose, nasal pharyngeal cavity area, but it doesn't actually get into your bloodstream, into your lymph nodes, so you don't have a full-blown reaction. So that's why some people may be mild, where when it gets into the immune system and you get a full systemic response, that's when you're going to see the more serious illnesses. And then, of course, your immune system, how well it responds at that point, may determine whether you get one of the more serious levels of response, which would be your respiratory inability to breathe and end up having to be ventilated or at least supported with oxygen.
That sounds a lot like the venom from a snake bite.
Well, I guess it can be compared to that as far as how much an individual responds to the particular.
Yeah, some people build up a tolerance. Some people fight it off better. Depends on where you get bit. And a big snake with a lot of venom.
Correct.
If he grabs hold of you, he can pump more into you.
Right. So it'd be similar in the fact that it does cause how much of your response, what level.
And why we're talking here and you're imparting this information, I'm spitballing. It really seems like someone that would go to a bar and be around a lot of people that are drinking. And some of them may have had too much to drink and they forget to stay 6 feet away. They could also be smokers. They could be spitting and coughing and hugging before the night's over. That's not good, is it?
No, that would not be practicing social distancing like you should.
Yeah.
But it increases your risk.
It does. Parties right now is not a good thing.
Big get-togethers.
We're seeing that UNC was just closed yesterday, and they have almost 200 cases of COVID. Mm-hmm. A lot of it is in certain areas, groups of areas. And I'm thinking maybe it's the parties, going back to school parties. And I don't know if it's specifically endemic to UNC, but in all colleges, you have parties, especially in the first of the year. Maybe I want to start rushing again and get the fraternities going. I don't think we're going to be able to experience that kind of campus life for the rest of this year. Do you?
No, I don't. I don't think it's a good event to get involved in. I think it's an area where there's going to be a lot of transmission that occurs. Drinking brings down your closeness with people, and so no, not a good thing.
No. And even for a young person that's a heavy drinker, that does happen sometimes. Would they be more susceptible to running the risk of getting a bad case of COVID?
Well, again, I think it depends on their immune system.
Yeah.
Yeah. So, I mean, the variables are still the same. It's how much exposure you have increases the likelihood of getting the virus into you. The longer that exposure is, the more likely it is to be high number of viruses that are introduced, and then your immune system is what matters after that. So,
do smokers have a more susceptibility to having a stronger reaction to COVID?
I haven't really seen much information about smoking and its contribution, other than the fact that smoking is going to increase your likelihood of having COPD and or cardiac disease, and those two conditions do lead to a higher level of bad outcome from COVID.
We're finding that COVID, once you get a bad case of it, your body starts fighting it,
right?
And it starts fighting it really hard, maybe too hard, and its fighting of the COVID. So it attacks the organs as well.
Right.
That's kind of a tough virus, isn't it? I don't know. Have we seen anything like that before?
Well, I mean, other viruses can have similar. Sometimes a flu strain can be pretty rough. We had a flu strain that came through in 2017 that was pretty rough compared to other flu strains. So I don't know if your viewers remember back in 2017, the flu, but we had a lot of deaths in young people at that point.
We did. I called it the crud. I didn't even get a temperature.
Right.
It stayed around 99. But I could not get phlegm out of my chest for about two weeks. Was that same flu, do you think?
It would be hard to tell me, or for me to tell you what virus it was without actually taking a culture and
but that would have been a virus. So
probably was a virus.
Non-smoker, normally strong, have really strong lungs, great expandability, do a lot of swimming, and I could not breathe. And it did not go to bronchitis, but it almost did. In fact, my doctor, knowing that I was susceptible to bronchitis, thought it could have been bronchitis, but it was probably a virus, wasn't it?
Yeah, there's quite a few different types of viruses besides influenza virus and then the coronavirus, there's also 4 or 5 others that we usually call those the common colds, but those can sometimes actually turn out to be pretty serious as well.
Well, everybody's not going to the hospital as soon as they get sick.
Right.
Not everybody's even going to the doctor, or are they?
No, a lot of people may not even know they have it, because I think as many as 20% of our positive cases were asymptomatic when we talked to them. Mm-hmm. So they didn't even know they had it, So that's 20% there. And then all but a few report being symptomatic. However, most of them aren't serious enough to go to the doctors or to the hospital. But of course, you have the certain percentage that have been put into the hospital. I think right now we have 7 Beaufort County residents in the hospital, and 2 of them are in ICU, but none of them are on ventilators right now. So there's different levels of care that they need.
Even though we've had 9 deaths in Beaufort County, which is, I think, high, especially considering the amount of cases we've had, which has increased dramatically in the last month.
Right.
I did the math this morning. The death rate is 0.0174%, or 1.74%. That's it. Yeah.
Talk about the 9 divided by the 519.
About 519, exactly. And good. And that's a little high. That's not like New York death rate, but that's higher than what we had a few weeks ago. It is encouraging to know that with 519 confirmed cases so far, we only have 7 in the hospital right now.
Right now. Today, this morning, yes,
That's
we
good.
had 7. It is, like I said, most people are mild to asymptomatic, but again, it's those few. And it's always been the few that we've worried about with this. It's a little bit higher. It's a little bit higher than the flu number in the number that go to the hospital and the number that are serious to the level of needing ventilation and then passing away, yes.
We've heard about hydrochloroquine, and we've heard about zithromycin. Did I say that right?
Right.
The
Zithromycin. Yes.
Zithromycin. Thank you. That's why I'm glad you're here.
Yeah.
And a combination of that with zinc. Some people might want to treat themselves. Is that frowned upon? Or if they have those drugs, if they have access to those drugs?
Well, to me, that's kind of falls in the realm of treatment, which is not what I deal a lot with.
Mm-hmm.
I try to stay up with that information, but I'm not the expert when it comes to medical treatment for people. I know that there's one study that I saw where they took 400 people and they gave them the chloroquine, and then 400 other people received a placebo, and then they compared how many of them contracted COVID over the course of a period of time, and there was not much of a difference between the two. So that would indicate it's probably not effective for the prevention of the virus. Now, there are some anecdotal studies and some doctors out there that swear by it, and it's not my decision what a doctor does as far as what kind of medical treatments they have. So,
I think they're prescribing it to reduce inflammation,
right,
for the internal organs, which sometimes can become so devastating once they go completely haywire.
Right, and again, I don't know a lot about the pharmacology of it, so.
And again, I think we're really frightened. We're really frightened as to how devastating this disease is, and to this extent, it's being treated, but we don't know the perfect treatment of the symptoms yet, short of a vaccine.
Well, we typically don't have much treatment for viruses, even flu, which has been around for a while. I mean, we do have some treatment for it if they're early on in symptoms, and a lot of the times that's to help boost your immune system or help your immune system to tackle the virus itself. So I know that the theory behind the chloroquine in combination with the zinc is to allow the zinc to kill the virus. But again, I don't know the pharmacology and how effective it is for treatment reasons. Operation
Warp Speed, which is coming down from the federal government, passing through the state and making its way down to Beaufort County, and you're going to be conducting that for the folks of Beaufort County. As everybody should know, I'm going to mention it one more time, the county government pretty much administers most of your services if you live in the city, and all of your services if you live outside of the city. And one of the things we do is we operate at the behest of the state government, even when in matters pertaining to COVID. And our Beaufort County Health Director will oversee a big part of this. Would you talk to us about what you expect to see and how you plan to handle it?
Right. Well, what we're hoping is this sooner that we get the vaccine, the better off we'll be, to try to help get the vaccine available for everybody. We are planning on setting out what we call point of distributions, or pods. And at the pods, we'll have stations set up for people to come through, and we're going to do this all through the drive-through system as much as possible. So they'll come through and they'll be able to receive the vaccination at those locations. we want to have our pods set up in Washington, Chocowinity, Aurora, and Belhaven. We'll run each pod for a week, and in Washington probably for 2 weeks because of the population size. And it takes a lot of manpower because we're talking about 100 people that have to get together to help make these pods work. And so, the citizens will be able to come through and get their vaccinations through that process. Now, that's the way we've been training at the health department for years. Some of your viewers may have participated about 3 years ago during flu season. We set up a pod where people got their actual flu shot through that system. So we are practiced on doing one pod, but now we're going to have to open up 4 or more pods. That's what we're going to plan on anyway.
When you say Washington, it's going to be one location in Washington, that location being the health department?
Well, we may do it there or at the community college, since that's kind of where we practice, and it's a lot more space.
It is a lot more space
to have people come through. So it'll probably be at the community college.
Which building?
Building 10 is where we practice. So I'm guessing that'll be where it is. Right.
And it's in the back, kind of out of the way.
Kind of out of the way. And we'll be able to drive the people through. Paperwork's always the hardest part of it. It's not the vaccine that takes very long. It's that paperwork that comes with it. But we do have to document everything and make sure that it's safe for people to receive it before they get it. That's the way we've trained all these years. I don't know if the state has other kind of options that they're looking at. They may contract with some of the pharmacies, because pharmacies can now do vaccinations as well. So they may contract with like CVS and Walmart, those places, to administer the vaccine as well, which would be nice as far as the workload on the county employees, trying to do all this. But certainly I don't know which plan to kind of run with right now. It'd probably be a mixture of the two somehow.
Will they ask your opinion on any of this? What would work best?
Well, they'll ask us as an association of health directors. They'll probably ask us which way. And then some of it may be just driven by requirements that the federal government puts in place,
You think there'll be different plans, like Plan A, Plan B, Plan C, like for opening up schools?
Are you changing the schools?
No, we won't go to schools.
Oh, okay.
That's another conundrum. I don't even know.
Oh, you mean similar to the way they came out with Play? Okay. Well, I'm going to have to plan it that way because I don't know which of those systems is going to come into play.
And you really don't know which is going to work best for Beaufort County quite yet, do you?
No. I think a lot of it depends on that contract. It also depends on, how the vaccine comes out, because there's so many variables. Like, will only 10% come out for the first couple of months, and then the other 90% will come out over the time period, because that's a lot of vaccine to produce.
It is.
And that there's going to be a lot of buy-in for where the outbreaks are occurring the heaviest. So they'll probably get a earlier exposure to the vaccine or earlier distribution. When it first comes out, if it comes out in limited supplies like that, then I'm going to have to create a plan where I hit the probably healthcare workers and then the at-risk population, the elderly population, those with high risk, before I can open it up to the general population. So I may have to do some of that. I can't tell you specifics because I don't know how it's going to come out to us. Anyway.
You really don't know yet how effective the vaccine will be. What kind of numbers are you hearing?
Well, first off, there's 25 vaccines that are being considered. There's 5 top candidates, and out of those 5 top candidates, I know that one of them is a 2-dose process. So you get 1 dose, and then 21 to 28 days later, you'll get the second dose. So planning for that is going to be totally different from the other 4, which is a single dose. I have not seen the studies that show how effective they are. So I really can't answer that.
Yes, I had heard Dr. Anthony Fauci speaking in the last few days. He said that he'd be happy with 50 to 75% effectiveness.
Yeah, I would be too.
And there's another thing to talk about. This vaccine is coming out quicker than anybody expected. The
Yes.
president has really worked hard. He's put a lot of money. A lot of people are blaming him for something that originated in Wuhan, China. However, a lot of people understand that he can't be all things to all people. The president is the president. He governs once there is a problem. And problems exist beyond mere mortal control. And viruses are one of those things. The president has worked hard to get Operation Warp Speed going and getting the CDC and all the other groups together. The money that has been put out there, the billions of dollars, do you know how that money's been distributed and to whom?
Specifically for Operation Warp Speed or for
Just
COVID
give me
itself?
A generality.
Well, I mean, I don't know for Operation Warp Speed how much money's been put out there. I mean, it's been quite a bit.
I hear a few $1 billion.
Oh yeah, we're talking about billions of dollars for the
Yes.
whole response. But how much of it went into one area? So I know some of it went into medical treatment of COVID. Some went into prevention of COVID. Some went into testing and contact tracing. Some went into development of a vaccine, and then some went into unemployment benefits and help with the businesses and stuff like that.
So we're talking trillions.
Yeah, well, yeah,
Well, trillion. Well, trillions, because I think we're talking over 2 trillion so far.
But yeah, that's what I'm saying. We're getting into a lot of money, and I don't necessarily keep up with all that.
Contact tracing, you mentioned that. That's a big part of what you do. It's a lot of work. It's something that you're good at. You've had to do it with SBDs. So you already have that infrastructure in place. How's it working, the contact tracing?
Well, I think in Beaufort County, it's worked really well. I think the staff at the health department has been really awesome in making sure that Beaufort County stays on top of contact tracing. I think that we continue to maintain contact tracing from the very beginning. Our first case, we're back in March, we contact traced that person, and we're still contact tracing everybody to this point that are positives. So typically what we try to do is we get notified of the person, and within 24 hours, we try to make contact with that person. And we're successful most of the time. Sometimes you get people that's phones are disconnected, and you have to go search a little bit harder to try to find them. But generally speaking, we get in touch with that person. Once we talk to that person, then we identify who they have been in contact with, usually like 2 days before their symptoms started until their
It's a real forensic process, isn't it?
Right. And so and then we call in all those contacts and we follow them for 14 days. And what we try to do is we isolate the positive case until their symptoms or until they're recovered. And then with the contacts, we quarantine them for 14 days. And during that 14 days, we make contact with them periodically to make sure that they're staying quarantined and that they're not symptomatic. We offer them a test as well. Typically, we would test the contacts about 5 days after their contact with the positive case, because that gives enough time for the virus to build up and now to be detected in the tests that we run.
I have 14 days seems to be the magic number, not only for quarantining, but for getting sick if you're in contact with somebody that may be more susceptible to the coronavirus. After 14 days, are we safe?
Well, generally speaking, let's go through the process. If I'm exposed to somebody with COVID, and if I contract it, my immune system starts to fight it off, I usually will start showing symptoms 3 to 5 days after that contact. However, my immune system can sometimes stay up with it for a while, but then by 14 days, I may develop symptoms as late as 13 days. So 14 days is, generally speaking, most people would have become symptomatic in that amount of time period. Occasionally a person may get sick after the 14 days, but it's so rare that you can't keep people quarantined indefinitely. So you got to pick a date. 14 is fairly safe.
From a personal standpoint, when I don't get out as much, my business here I can do with the computer and remote. and I can deal with people that way. Sometimes I get out, but sometimes I get pushed in with folks that I know go out a lot, and they like to be social, even in these times where we have to be a little bit antisocial. So I'm always concerned as to, I mark on a calendar when I last was with that person, and then I watch the days click by. I will tell you this, when I go out, if you see me in your office, I will have this on. It's a double mask. It says KN95. Does that help? Is that a good one?
Well, it's
Helps me
it's
a
not a
little
level of N95, but it's
a little closer.
it's close. Yeah.
This is for them. This is a little bit for me.
Right.
So I'm going to have a double mask on if I come in, and I do it not because I think masks are the end all be all. It's a matter of courtesy, but I'm going to do everything within my power not to get you sick. And I think we all need to be more like that. Oh, and I'm going to stay at least 6 feet away from you. And just like Jim and I are staying 6 feet away from each other. We've known each other a lot of years. We're fond of each other.
Yeah.
But we're not going to get real close to each other.
No, not now anyway.
And we have to practice that.
Right.
That could make all the difference for us all. We're all probably going to get this coronavirus at some point, don't you think? It's going to hit all of us.
No, I think we'll get the vaccine before we get there, Stan. I think that the vaccine will help.
Even after the vaccine, I want to talk to you about that.
Okay.
Even after the vaccine, say it's 50% effective.
Right.
Maybe it's 75%. You could still get COVID.
Yeah, if the vaccine doesn't take, so if you're on the bad side of the 50%, then yes, you are more, likely to be able to catch the virus.
Will one vaccine get it? Will you have to take the vaccine every year or every other year or every 5 years?
I don't know that they're going to do that. That's one of the long-term things that need to be looked at. That's how long your immunity stays. Because right now, they're still not even sure, once you've had COVID-19 disease infection, they're not even sure how long you may maintain your immunity at that point. Again, that goes back to what kind of immune response did you have? Was it all up in the head, where, it didn't create a systemic response, so your immunity may not be as long as somebody that really fought it off?
Well, this year, when the vaccine comes out for the regular flu,
right,
I'm going to predict you're going to have an onslaught of people wanting to get that vaccine as well. Don't you think?
I believe so.
I mean, they're going to throw all caution to the wind, and
Right.
they're going to come for the vaccine. Then once the other vaccine comes out, if they're smart, they're going to really want to get that vaccine, because this is the most corrosive virus in my lifetime. I mean, I'm hearing this is being compared to the Spanish flu.
Well, it is. I think, and that's called virulence of the virus. So
Yeah.
It is pretty high. So I think it's, again, there's been flu strains that have been pretty bad throughout we were around in 1918 with the Spanish flu, but, a lot of people went through the swine flu in the 70s, and that was a pretty bad year as well. But again, I go back to the 2017, which was a bad year. I think we had about 10 deaths in Beaufort County from 2017 from the flu.
We've had 9 in Beaufort County from this.
So far.
We're just so far.
Yeah.
Yeah, so far. It could be worse. We pray it won't be, but it could be worse.
But I guess you were alluding to the fact that we're going to have the flu vaccine and the COVID vaccine probably going at a similar time.
Yes.
Yeah, and I don't know, what recommendations to make right now as far as how much to space between the two.
Yes. That is a question I was going to ask.
Right.
Thanks for coming back around. The question was, in conjunction with one another, what will be the recommendations? And right now, you really don't know, and that means you got to come back.
Yeah.
You got to come back. We got to see you. And a lot of people will hear your report. Jim Madson speaks to the Beaufort County Commissioners at every meeting from here on out. Won't you?
About every month. I probably will until it's over with. Anyway.
Until it's over with?
Yeah.
And that will be on Beaufort County Now. We put that on Beaufort County Now. A lot of you watch it on Beaufort County Now because we upgrade the quality of the production, which is not very good coming from the county. This production is very good. And Jim's going to come back and visit with us. Can you come back in about 5 or 6 weeks?
Well, I'm sure I'll find the time. But,
Thanks.
yeah.
Thanks. And we've covered a lot today.
Yes.
We can cover more next time.
Yeah.
I'll
probably know more about the vaccine next time.
Outstanding. We'll talk about Operation Warp Speed. We'll have Jim back. And if you're done for the day, we're done.
Okay.
Thanks for coming and visiting with us today here at Beaufort County Now and What's Happening Now. Jim Madson, thank you for coming.
It's my pleasure.
You will come back and you will stay informed. Good day.